Leukemia is a malignant disorder of white blood cells. Bone marrow is always involved in this disease. The exact causes of leukemia is unknown, but hereditary or viral or exposure to radiation may be suggested. The major symptoms of leukemia includes weight loss, fever, and increased sweating. Liver, spleen, and lymph node are enlarged. The basal metabolism rate is also increased. The classification based on the course of diseases, leukemia are classified as acute and chronic. Acute leukemia, it is a sudden onset, generally occurs in children under 14 years of age. It is associated with normocytic normochromic anemia with increased platelet count. The bleeding time is prolonged and white cell count may increases up to 1 lakh cells per cubic millimeter. Immature and blast cells are present in peripheral blood smear. Acute leukemia is a rapid progressive disease. Chronic leukemia, it is a slow progressive disease. Anemia may occur at a later stage. The white cell count is markedly increases and may go up to 9 lakhs per cubic millimeter. The blast cells are also occasionally in between. These two, subacute leukemia is also found in some cases. It is quite similar to acute leukemia, but the total leukemia count may be normal, decrease or increase up to 50,000. Classification. The leukemia are further classified on the basis of cell origin, that is whether myeloma or lymphocytic. One, acute myelocytic leukemia, AML. Acute lymphocytic leukemia, acute myelocytic, chronic myelocytic leukemia, chronic lymphocytic leukemia, acute myelocytic leukemia. The acute myelocytic leukemia occurs in all age groups but more common in adults than in children. It is also called as acute granulocytic leukemia. It is characterized by presence of large number of myeloblasts in the bone marrow and the appearance in the peripheral blood. The myeloblast in the peripheral blood may vary from few to as much as 95%. Many variants of acute myeloblastic AIMC have been described depending upon the type of cell predominating in the peripheral system. These could be myeloblast, promyelocytes, monoblast, or blast of both myeloid and erythroid series. The AMC, there is often inflammation of gums, skin involvement, rectal ulceration, and face tumor is observed. It is generally associated with the normochromic normocytic anemia. The acute myelocytic leukemia is rapidly fatal, with most patients dying from hemorrhages or infection due to the bone marrow failure. Acute lymphoblastic leukemia. The acute lymphoblastic leukemia is more common in children than in adult, that too in male than in female. It is less severe than AMC, and in many cases it is cured by intensive and sustained treatment. Acute lymphoblastic leukemia is a malignancy of cells of lymphocytic series, and it is characterized by the presence of increased number of lymphoblasts in bone marrow as well as in peripheral blood smear. The bone pain, fever, bleeding, purpura, thrombosis, lymphadenopathy, and central nervous system involved in common in acute lymphoblastic leukemia. To differentiate between the diagnosis of acute myeloblastic leukemia and acute lymphoblastic leukemia, all special cytochemical stains and immunological markers can be used. Chronic myeloblastic leukemia. The chronic myeloblastic leukemia is called as a chronic granulocytic leukemia. It is common in middle age group. It is characterized by the presence of marked increase in cell of myelocytic series. The predominant cells are neutrophilic, myelocytic, and metamyelocytic. The total leukocyte count is generally higher than 50,000 to 2 crores per microliter. The symptoms due to the hypermetabolism are common in chronic myelocytic leukemia. The anemia is normocytic normochromic. The platelet count is usually increased. The abnormal Philadelphia chromosome is present in the leukemic cells, or more than 95% of patients with chronic myelocytic leukemia, and the chronic myelocytic leukemia may develop into acute myelocytic leukemia. Chronic lymphoblastic leukemia. The chronic lymphoblastic leukemia is more often found in older person over 60 years, with men affected with than women. It is characterized by marked increase of mature lymphocytes above 15,000 cells per microliter. The cell count may go very high, and 80 to 90% of the cells look like immature lymphocytes. The prognostically, patients of chronic lymphoblastic leukemia may live for many years without a treatment. The onset of this disease is slow and in early stages asymptomatic. Most patients have weight loss and developed lymphoadenopathy in later stages of chronic lymphoblastic leukemia. The neutropenia, thrombocytopenia, and loss of normal functioning lymphocytes leads to inadequate immune response, resulting in various infections. The anemia also developed in the last stage. Clinical classification: acute. The patient will die quickly, weeks or months without treatment. The association with the very immature, undifferentiated cell, little mature and therefore normal functions, and some intermediate maturation, less than 30% blast in bone marrow. Chronic. Without treatment, it may be months or years before death. Mature and immature cell present 30% of blast in bone marrow.